Hello students, we'll discuss a clinical scenario or case which is actually common in females, but when it occurs male, it is quite important and it has got certain other factors which you have to remember. See that male, you can, mustache is there, beard is there, so male patient, thyroid is enlarged. See that most mainly towards the left side, extend to the right side, is quite big. Thyroid, quite big, large thyroid actually. So male thyroid swelling is, whatever thyroid disease is common in females, but when thyroid swelling, which is not that common in males, if it occurs, you have to consider as a high risk category for malignancy. So you need to advise thyroidectomy to such patient. That's the dictum which out male thyroid is high risk category. So you have to consider malignancy. You have to rule out more often rather. You have to advise thyroidectomy to such patient without much delay. It's the basic thing you have to remember. Otherwise, thyroid, most of the time you see in the ward, commonly it's seen in the females, not that commonly seen in the. It can occur like this. Ratio is less compared to this. So compared to females, ratio is less. So that's the point I want to stress actually. So carcinoma should be suspected always. Find out duration for that. Progression, detailed history is important. Is how to confirm thyroid, movement with the retribution. So you know that you can see my clinical method in surgery. It is there how to check that one. Video also there in my clinical methods in surgery. You can do that. Lower border is important. Thrill is important for the vascularity. Bruise is important. Tracheal deviation is important. And nodules, how many are there, is important. Neck lymph nodes have to be examined. Leahy's method of examination. Kray's method of examination. Pizzolos, especially like this, that is in females, especially not commonly in females, mainly in obese and short neck patient. Thyroid becomes prominent to inspect thyroid. And toxicity features you have to look for. Cardiovascular system have to examine. Hepatomegaly, if it is there, you have to look in toxic thyroid and Hashimoto-thyroid, that is autoimmune disease. Thyroid enlargement can occur with hepatomegaly, splenomegaly also. Respiratory system should be examined. Skull should be examined. Malignancy, when it occurs, follicular carcinothyroid, pulsatile, localized, warm, swelling, so mainly in the frontal bone, flat bone. It can occur anywhere, other parts, other bones also, commonly in the skull bone, especially frontal bone. A very typical metastasis on the follicular carcinothyroid. So you have to examine a skull also. Neck examination, I told systemic examination. I have told all these things. Please go through my clinical methods in surgery. There is a video also how to examine a patient of thyroid swelling, and detailed examination method with the clinical reasoning with the differential diagnosis given in my book. You can always go through that. Of course, thyroidectomy, carcinoma thyroid, again given in my manual of surgery. Thyroid topic in detail, differentiated thyroid cancer, papillary, follicular, medullary, anaplastic, and etiology, management, investigations, thyroids, all those things are given in very clearly. So important thing is male thyroid enlargement is not common, but we'll see, not as common as a female, I will put it like that. And it is always a high risk category for malignancy. That's a point I want to stress. Evaluation, same thing, ultrasound, neck, lymph node and thyroid assessment, then T3, T4, CSH, MRI, maybe evaluation for metastasis, you have to do that, CT head and other things, CT chest, total thyroidectomy, radioactive therapy after retinal scanning, then suppressive dose of L-thyroxine. When it comes to the differentiated thyroid cancer, usually maintenance dose is 100 microgram, suppressive dose is, you have to suppress the TSH, because TSH is very important to proliferate the tumor cells. If there is no TSH, tumor will not proliferate. Even if few cells have left behind, it will not proliferate and will not cause recurrence or metastasis. So that is why suppression of TSH with the high dose of thyroxine is important. Only drawback is high dose of thyroxine may cause toxicity, subclinical or sometimes clinical, including cardiac toxicity, and sometimes it causes osteoporosis also. So these are the different problems with that, but it is essential to contain the tumor and prevent the recurrence and metastasis, so that you attain a cure, because it is one of the curable malignancies, especially papillary carcinothyroid. So other curable malignancies, you know that papillary carcinothyroid, carcinoma colon early stage, definitely marginal ulcer, varicose carcinoma, and basal cell carcinoma. They are the different malignancies which are curable. Almost they get cured and they have a full life, and they probably die of other event like cardiac event, old age, other stroke or other things rather than this malignancy. But remember, should be treated as per protocol, as properly, and proper follow-up is essential. All these categories. Otherwise, eventually it will progress and kill the patient. That's the point you have to remember. Curable means without treatment. With the treatment, it is curable. That point is very, very early treatment. Again, is very important in all these patients. So malignancy in thyroid is especially differential thyroid cancer. And then again, papillary carcinoma thyroid is curable if you treat properly. That point you have to remember always. So remember all these things. Classification thyroid swelling. Thyroid swelling itself is a long case, and thyroid neoplasm is a long question in the exam. Each type, papillary carcinoma, follicular carcinoma, medullary carcinoma, anaplastic carcinoma, they are short notes. Staging is a short note. Treatment is a short note. Thyroglobulin is an important marker. This is a short note. And radioactive iodine therapy is a short note. Evaluation is a short note. Ultrasound, this one, TIRADS is a short note. So different things you have to remember. Different codings are there. And neck dissection, completion thyroidectomy, central neck dissection, lateral neck dissection, prophylactic neck dissection, therapeutic neck dissection. All those meanings of these you should know, you should remember. Meaning of advanced carcinoma thyroid, spread in the follicular carcinoma thyroid, mainly blood, papillary carcinoma, mainly lymph node, anaplastic carcinoma is the most aggressive malignancy, medullary carcinoma, male done in family, and again spread to the lymph node. Surgery, the treatment for thyroid carcinoma. That point always you have to remember. So read my manual of surgery. It gives very detail about the thyroid malignancy, thyroid hormones, surgical approach, total thyroidectomy. It's a technique, operative steps, and also complications of thyroidectomy like hemorrhage, recurrent annular injury, parathyroid insufficiency, thyroid storm, wound infection, which is not that common. All those things, whatever the complications which can occur, is clearly in detail given in my book, Manual of Surgery. Please go through that, and of course clinical methods in surgery to how to examine the patient. So students, go through my MCQ. The Lindsay tumor is, give the right answer, put it in the comment box. I'll really acknowledge and appreciate your answer. A, B, C, D, find out the answer. More aggressive type of papillary carcinoma of thyroid is classic type, micropapillary type, follicular variant papillary carcinoma, diffuse fluorescent type papillary carcinoma. Put the again right answer. All these things are the commonly asked MCQ question, students. So quotation of the day is, there will be always sunrise after sunset. Because there is not every day is you are in trouble, darkness. There will be always hope in the life. So today you are in trouble, tomorrow will be doing very well. So don't get disappointed for small things. Look at the future, forward rather than backward. That's exactly meaning of this quotation. Very, very correct in medical profession and especially in surgical career. Students, please go through my SRB's Manual of Surgery, SRB's Clinical Methods in Surgery, and SRB's Operative Surgery, Surgical Atlas. The new edition has come, and Atlas on such a steering technique. Manual gives everything in detail about all topics as per CBM syllabus: general surgery, gastrosurgery, urology, neurosurgery, cardiothoracic, and basic instruments, specimens, brief operative surgery, which is essential for UGs. Everything is covered with the quotations, with the illustrations, the diagrams, photos, covered everything as for CBM syllabus. And clinical methods in surgery, current edition gives a proper clinical idea, approaches to all cases, briefly orthopedic also. Again, it contains instruments, specimen, images also, and videos. Each chapter videos are there how to examine a patient, which is very important when you do a practical exam, clinical exam. So very, very useful, everything, with again lot of photos and proper methodology of examination with the differential diagnosis tables are given. So it will be very, very useful. Of course, operative surgery is a very detailed 2-volume extensive book with more than 10,000 photos and illustrations. Whenever you want to any surgery, including specialty, general surgeries, gastrosurgery mainly, in detail it is given. It will be very, very useful. So students, also go through my SRB's Surgery Insight YouTube Insights, and please subscribe for all these lectures, daily lectures for brief 6 to 10 minutes. and live sessions once a week or once in 2 weeks I'm doing. They're also very, very useful for students with with the interaction with the senior faculties are there, and always they can answer your doubts and through chat. So please subscribe my channel, YouTube, Instagram to have a better knowledge and increase your surgical knowledge as such, because it is free also. And my DigiNow lectures through JP, around 220 lectures covering everything surgery, including specialty, operative surgery, clinical methods also, with the videos through JP Publishers. And you can always purchase that one for 1 year, so that you can have go through all lectures, so have a very clear idea about the subject to face any exam, including NEET or final year exam or even PG exams. With this, I hope you understood this lecture. Male thyroid, very, very important, very well. Thank you so much.